April Kern here at Smiles of Reston Town Center. I'm here today to talk to you about deep cleanings. And please don't turn this video off. It's not going to be gross. I'm not going to show you like bleeding gums, I promise you. But this video is like kind of like the truth about deep cleanings, and hopefully you won't be scared after watching this video. All right, so a deep cleaning is different than a regular cleaning, and a lot of my patients ask me what the difference is. So a regular cleaning, we're cleaning above the gum line, and then a deep cleaning, we're going a couple millimeters or a few millimeters below the gum line. And deep cleanings are needed if you are diagnosed with gum disease. So every time you come to the dentist for a cleaning, they should be screening you for gum disease, okay? And we have a little poster here. This is as scary as it's gonna get, okay? So what we're doing is we're actually taking a millimeter ruler and we're measuring how healthy your gums are. So they should be nice and tight and hugging your teeth. So 1s, 2s, and 3s are really good numbers. 4s are like kind of okay, might be some inflammation, but we can work with that. And like 5, 6, 7, 8s, and 9s, that means we're getting that ruler down that many millimeters in between your teeth and your gums, and you most likely have gum disease. And the treatment for gum disease, first line of treatment is a deep cleaning. Now, don't worry, it sounds kind of scary, right? You're like, deep cleaning, is that like a deep tissue massage? It's gonna feel good, it's gonna feel like pressure, but you're gonna be numb for it, okay? And the other thing about a deep cleaning versus a regular cleaning is it's usually we'll do half of your mouth at one time, so there's 2 appointments. Like upper right and lower right done, and then your lower left and your upper left done. And then after you have a deep cleaning, you need to come to the dentist every like 3 or 4 months afterwards to make sure that your gum disease is truly healing and responding to treatment. So after your deep cleaning, you'll usually come back like 6 weeks later and we'll retake those measurements, okay? And we'll see if we've had the improvement we want. And if we don't, then we can talk about other options, which might be like to go to a specialist or to place like a little pellet of antibiotics like in between your teeth and the gum. So there's a lot of options for treatment of gum disease. Once you have a diagnosis of gum disease, you need to do your part at home. So you need to be like the most awesome brusher flosser in the entire world, okay? We're gonna recommend an electric toothbrush. We're gonna up your game with that twice a day. And you're also gonna be flossing, maybe even using a water pick, because what causes gum disease is bacteria. And this bacteria is like super sneaky and it's super hard to get rid of. And also gum disease, we call it like a silent disease, because a lot of times you don't even hurt. You don't know that you have this disease. It's all bacterial. So you might have bad breath or you might have bleeding gums, but a lot of times you don't even know you have gum disease, and it's really, really hard to get rid of. So you have to get that bacteria out from underneath your gums so everything heals and is nice and healthy. Okay, I don't know how many people actually got to the end of this video about gum disease and deep cleanings, but I hope you learned something. Thanks, bye.